There are moments in life when your body whispers before it screams, and the difference between those who thrive and those who struggle often lies in whether they choose to listen. Imagine waking up one day, feeling slightly more tired than usual, your breath just a little shorter, your body carrying a quiet weight you cannot fully explain. You brush it off, telling yourself it is just another ordinary day, just another passing discomfort. But what if that small signal is not ordinary at all? What if it is your body trying to protect you, urging you to pay attention before it is too late? Living with chronic kidney disease is not only a physical journey, it is a mental and emotional awakening that demands awareness, courage, and responsibility. It challenges you to become deeply connected with your own body, to notice the subtle changes, and to act with wisdom instead of fear. Many people believe strength means enduring pain in silence, but true strength lies in recognizing when something is wrong and choosing to act decisively. The truth is, not every symptom requires panic, but some demand immediate action, and understanding the difference can save your life. This is where knowledge becomes power, and awareness becomes your greatest shield. As Dr. Mathew R. Weir has often emphasized through his teachings, early recognition and timely response can transform outcomes in ways people often underestimate. Your body is constantly communicating with you, sending signals through discomfort, fatigue, swelling, or changes that may seem insignificant at first glance. Yet, these signals are never random. They are part of a deeper message, a call to awareness that should never be ignored. When you begin to understand this, you shift from being a passive observer of your health to becoming an active guardian of your well-being. Chronic kidney disease does not define you, but it does require you to rise to a higher level of self-awareness. It asks you to take ownership of your health decisions, to stay informed, and to act when necessary, even when it feels uncomfortable or inconvenient. The emergency room is not a place anyone wants to go, but sometimes it becomes the place that protects your future, the place where timely action prevents irreversible consequences. Recognizing when to go, there is not a sign of weakness, it is a sign of wisdom and self-respect. Life does not always give loud warnings before serious complications arise. Sometimes it offers only quiet hints, subtle discomforts, and fleeting moments of unease. The question is, will you notice them, or will you ignore them until they become impossible to overlook? Your journey with chronic kidney disease is not just about managing a condition. It is about developing a mindset of awareness, resilience, and proactive care. It is about understanding that every decision you make, every signal you acknowledge, and every action you take has the power to shape your future. And in that understanding, you begin to realize something profound. You are not powerless in this journey. You are deeply capable of protecting yourself, one mindful choice at a time. But there is a turning point in every journey. A moment when what seemed manageable begins to shift into something far more urgent. And this is where many people hesitate, caught between doubt and action. You may start to notice that your breathing becomes heavier, not just after exertion, but even while resting, as if your body is struggling to keep up with something unseen. Your chest might feel tight, your heart racing or pounding in a way that feels unfamiliar, and a quiet question begins to form in your mind. Is this serious? Or am I overreacting? This is the moment where awareness must overcome hesitation, because the cost of waiting can be far greater than the discomfort of acting. Chronic kidney disease can quietly build pressure within your body, affecting your heart, your lungs, and your overall balance in ways that are not always immediately obvious. Swelling in your legs, feet, or even your face may seem like a minor inconvenience at first, but what if it's your body signaling fluid overload? A condition that can escalate rapidly if ignored. Confusion or sudden difficulty focusing might be brushed aside as fatigue or stress. Yet it can also indicate that toxins are building up in your system, affecting your brain and your ability to think clearly. These are not just symptoms. They are urgent messages that demand your attention, and ignoring them can lead to consequences that are much harder to reverse. As Dr. Mathew R. Weir has highlighted in his approach to patient awareness, the difference between a manageable condition and a medical emergency often lies in how quickly one responds to these warning signs. The challenge, however, is not just physical. It is deeply psychological. Fear can make you hesitate. Pride can make you delay. And uncertainty can make you second-guess what you are feeling. You might tell yourself that you will wait a little longer, hoping the symptoms will fade, hoping that it is nothing serious. But in that waiting, the situation can quietly worsen, moving from something controllable to something critical. Suspense builds in these moments, not because something dramatic is visibly happening, but because everything important is happening beneath the surface, hidden from plain sight. Your body is working harder, your organs are under stress, and time becomes a crucial factor that you cannot afford to overlook. Extremely high blood pressure can silently damage your system without immediate pain, and sudden changes in urine output can indicate that your kidneys are struggling in ways that require immediate attention. These are the moments where action is not optional, it is necessary. Going to the emergency room is not about fear, it is about responsibility. It is about recognizing that your life, your health, and your future are worth protecting, even if it means stepping into uncertainty. The people who learn to act in these moments are not the ones who panic, but the ones who understand the value of time and the importance of listening to their bodies. They do not wait for certainty. They respond to possibility, because they know that early action can prevent irreversible outcomes. And as you stand in that moment of decision, you must ask yourself a powerful question. Is it better to wait and risk everything, or to act and protect what matters most? The answer to that question defines not just a single moment, but the direction of your entire health journey, shaping whether you move forward with strength and awareness or fall behind due to hesitation and doubt. And then comes the realization that changes everything. The quiet but powerful understanding that your life is shaped not by the absence of challenges, but by the decisions you make in the face of them. Chronic kidney disease may place obstacles in your path, but it also gives you an opportunity to rise with greater awareness, discipline, and purpose than ever before. Every signal your body sends is not an interruption to your life. It is guidance, a form of protection that, if respected, can lead you toward a safer and stronger future. When you begin to embrace this mindset, fear starts to lose its grip on you, and in its place comes clarity. You no longer see symptoms as random discomforts, but as meaningful indicators that deserve your attention. You start to act not out of panic, but out of understanding, knowing that each timely decision you make is an investment in your well-being. As Dr. Mathew R. Weir has consistently emphasized through his work, proactive care is one of the most powerful tools a patient can have, and it is often the difference between stability and crisis. This journey is not about living in constant worry. It is about living in constant awareness, a state where you are tuned into your body and confident in your ability to respond when it matters most. You begin to build a relationship with your health that is rooted in respect, patience, and responsibility. You learn that going to the emergency room when necessary is not an overreaction. It is an act of self-preservation, a decision that honors your life and everything you hope to achieve. The strength you develop through this process extends far beyond your physical condition, shaping your mindset, your resilience, and your ability to face uncertainty with courage. You start to understand that every moment of awareness, every choice to act, and every step you take toward better care is a victory, no matter how small it may seem. Over time, these small victories accumulate, creating a foundation of strength that supports you through even the most difficult situations. You are no longer defined by the fear of what could go wrong, but empowered by the knowledge of what you can do right. This is where true transformation happens, not in dramatic breakthroughs, but in consistent, mindful decisions that protect your health and preserve your future. Your journey becomes a testament to the power of awareness and the importance of taking responsibility for your own well-being. And as you continue forward, you carry with you a deeper understanding that your health is not something to be taken for granted, but something to be actively protected every single day. The message is simple yet profound. Listen to your body, trust your instincts, and never ignore the signals that could save your life. Because in the end, the ability to act at the right time is one of the greatest strengths you can possess, and it is a strength that can change everything. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.